Hi everyone, welcome back. So here we are, my last webinar of the week, and we're going to be covering male factor infertility and investigations. So a little stat for you. Did you know that 40% of fertility issues have an element of male factor fertility? So whether it's the sole factor or a joint with female issues, 40% is quite a big stat. So as a woman who's struggling to conceive, how many times have you been prodded, poked, scanned, tested? I can guarantee that it's a lot more than your husband or your partner has. So how frustrating is that? It could be that the main issue or a large proportion of your fertility issues are to do with sperm quality, but no one's looking at that, they're looking at you. So how do male factor fertility issues get diagnosed or investigated? So more often than not, a basic sperm analysis is completed by a GP or a fertility clinic, and that's it. So we'll talk a little bit more later about the more in-depth testing you can do. However, first of all, I just wanted to talk a little bit about what constitutes a normal sperm analysis. So there's a few components to sperm. So you have the actual sperm count, and this is the number of live sperm within any one sample. You have the motility, which relates to whether they're swimming in the right direction. It's no good if they're swimming around in circles. And you have the morphology, which relates to the number of normal sperm. So some sperm will be abnormal, and that's normal, is the percentage, the ratio of how many normal to abnormal you have. You also have the pH level of the sperm, so how acidic or alkaline it is, and that will definitely affect the quality. So in order for sperm to be optimal, all of these things need to be not only within the parameters, but they need to be in the top of their reference range. And this goes for anything within the realms of fertility. Things need to be optimal and not just within that reference range. I recently had a client who'd been trying to conceive for some time. Her husband had a morphology of 1%, and she'd been told that this was normal, and it's just not the case. It should be much higher, around 4% as a minimum, and to be optimal, really around 10%. So previously, we've always thought that providing a sperm can fertilise an egg, then it's a done deal, it's done its job, that the embryo will continue to develop normally and that the sperm's tip-top. However, lots of recent studies and evidence are showing us that the quality of the sperm has much more far-reaching effects. So, for example, poor sperm quality has now been shown to have a greater involvement in recurrent miscarriage than we thought, and also implantation failure in fertility treatment cycles. So why is this? Well, a basic sperm analysis is just that. It's a basic test, and it actually doesn't give us too much information about the sperm. So the one key thing that can't be seen, even by the embryologist within a lab, is the DNA of the sperm and whether it's been damaged by something called oxidative stress. So how does the DNA of the sperm become damaged? So the official name for this is sperm DNA fragmentation, and it can come from either lifestyle factors or physical issues such as something called a varicocele or infection. It's impossible to tell whether sperm has this damage without completing a sperm DNA fragmentation test. However, there can be some indicators on a basic test, such as poor motility or poor morphology. So if I ever see this on a client's sperm test result, then we would be looking at the sort of deeper level of sperm testing. There could be some damage going on there. So let's talk about some physical factors that can cause issues. So first up, what's a varicocele? This is a bit like a varicose vein in the testicle, and it causes low sperm production, reduced sperm quality. So to give you an idea of statistics relating to this, around 15% of men will have a varicocele. And in a big study that evaluated men for infertility, around 40% of men had an undiagnosed varicocele. So I'm coming at you with all the stats today. They're quite high numbers. So it's definitely something that needs to be investigated in more couples who are struggling to conceive. The treatment for a varicocele is normally surgery, but nowadays this can be treated with minimally invasive laser surgery. It's really not a big deal, and it can make a really big difference to sperm quality. Another physical factor could be low-level infection. So I recently had a client whose partner started seeing an andrologist after a poor sperm DNA fragmentation test, and they discovered that they had a really low-level infection, probably from an old sexually transmitted infection, and after a few weeks on antibiotics, the sperm quality was much improved. So when we talk about lifestyle factors, we're we're talking about the obvious things, so smoking, drugs, alcohol consumption, but there's also a few things that you might not have considered. For example, what does your partner do for a living? Does he come into contact with toxins or pesticides on a daily basis? So I've had clients whose partners are gardeners, they are mechanics. I had one that was even a painter, and they're coming into contact with damaging toxins on a daily basis, and all of them returned high DNA fragmentation levels on a test. Another way to assess whether sperm DNA fragmentation might be having an impact on your fertility is, if you're in a treatment cycle, is by tracking and seeing what happens within the lab. And you can do this by asking the embryologist what's happening at each stage. Most of the clinics tend to be quite good and they'll ring you throughout that 5-6 day wait period, but you can always ask. So the DNA of the sperm starts to have an impact at day 3 after fertilisation. So if after day 3 the embryologist says to you that you've had a drop-off in the numbers of healthy embryos, then that can be an indicator that DNA fragmentation is playing a part. So for example, if you were lucky enough to have 10 eggs collected, you then got, say, 8 that fertilised, but then after day 3 the embryologist rings you and they say you've only got 3 left and they're not all expected to make it to a day 5 blastocyst, or you've got less than that left and they're not doing great, then I would be looking more closely at the sperm quality for sure. So the good news is that sperm is highly changeable. And if you can work out why the DNA fragmentation levels may be high in the sperm, then you have a really good chance of fixing that issue. So generally sperm takes around 72 days to regenerate, and therefore we say that a 3-month cycle is kind of optimal to make any changes to sperm quality. So at the fertility method, after going through your case history with a fine-tooth comb and assessing whether sperm quality could be a priority for your case history, then we would work together and we'd provide a referral to a recommended andrologist who would check for infection. They check for varicoceles, they check your hormonal profile. Yes, men are also governed by hormones, so who would have thought it? So the sperm production is ruled by the signals from the pituitary in the brain. So if there is a hormonal imbalance, then this can mean problems with the sperm. So all of these things can be checked. That's just a simple blood test. So you can take a supplement called Impril, and again I'll link that below. This has been proven to really improve sperm quality, and it's the main supplement that's recommended by some of the top andrologists in the country. So evidence shows that over supplementation in men, so taking too many things, can actually have a negative impact on sperm quality, and therefore most specialists will recommend just taking Impril. Impril alone is enough to have a good impact on positive change to the sperm. So as you can see, there is so much to be done to help diagnose and treat male factor fertility issues. It's just such a shame that so many couples have to go through repeated unsuccessful fertility treatment cycles or years of unexplained infertility before it's actually taken seriously. But hopefully the tide is turning. The World Health Organization has just recommended that a sperm DNA fragmentation test should be included within the basic markup of tests for couples going through fertility treatment. So that's a sign that this is starting to be taken more seriously. So if you think that male factor infertility might be contributing to your fertility issues, then this is an area we can really help with. So you can book your free discovery call using the link in our Instagram bio, and we can have a chat about exactly how we might be able to help you. There's lots of areas we delve into, and male factor fertility is just one of them. So I hope you found the webinar helpful. We've got Nicola last up tonight, and Nicola's doing a live emotional freedom technique, or tapping, you might know it as, session. So be sure to join us later, and remember that you can post any questions in the group and we'll do our very best to answer them. Thanks for listening.